Cats may become more reactive or aroused when they leave their familiar environment. To protect themselves, they may run away, hiss, scratch, or bite. This often upsets the client and makes it difficult for us to do what is needed for the feline patient. It helps to understand that fear is the #1 cause of feline aggression in the veterinary hospital. These cats are wonderful at home, but may have fear aggression if exposed to situations or people that have caused fear in the past or are unknown. Familiarity makes cats more comfortable in the environment. To prevent fear, make the hospital environment more familiar by encouraging clients to bring recognizable objects from home, such as the carrier, which is left out all the time so that the cat considers it a safe haven, a blanket or clothing with the scent of a familiar person, treats, and toys. If the cat at the veterinary hospital will not leave the carrier voluntarily, quietly and calmly remove the top half of the carrier whenever possible so that the cat can remain in the bottom half. In many cases, the entire examination can be done with the cat in the bottom half of the carrier. If a cat must be removed from the carrier or stay at the hospital for any reason, be sure to also keep the blanket or clothing that was placed in the bottom of the carrier with the cat. If the cat is highly aroused, slowly slide a towel between the top and bottom halves of the carrier while the carrier top is being removed. This cover provides a safe hiding place for the cat and helps protect the handler. Always move slowly and come from behind instead of in front of the cat to prevent visual arousal. Much of the exam can be performed with the cat hiding under the towel and inside the carrier bottom. If needed, the towel can also be used to wrap the cat so that the exam can be completed with the least amount of struggling. The exam does not need to be done beginning at the head and working towards the tail. Instead, start by examining the non-painful areas and those that do not arouse the cat. The entire exam can be done from behind or the side so that we aren't looming over the cat or staring, both considered threats to the cat. By first performing the least stressful parts of the exam and reserving the others for last, most cats will remain more relaxed and calm. For example, if the teeth are painful, wait until the end for the oral examination. If arthritic, palpate the legs at the conclusion of the exam. Also, give a short-acting analgesic with rapid onset to keep the cat comfortable. This is done for any painful or possibly painful condition, such as possible lower urinary tract disease, dental disease, pancreatitis, or arthritis. Buprenorphine can be given transmucosally in the cheek pocket or under the tongue. This prevents pain during examination of the painful area. While waiting for the opioid to take effect, the rest of the examination and sample collections are done. When analgesia is effective, complete the rest of the examination. There will always be an occasional cat that will be fearfully aggressive. Pain relief and anesthesia can be very helpful for these patients and will make subsequent visits less stressful.